I am consultant ENT head and neck surgeon, Dr. Devesh Shrivastava, presently working at Nishat Hospital, Lalbagh, Lucknow. Here I am just giving you some important points about the care of the ear and the problems of the ear. Ear, as we know, basically three parts: external ear, middle ear and inner ear. And all the problems belong to these three parts. Like if somebody has got problem in the external ear, it can present with deafness. But you see, as we know, the prevention is much better than treatment or the pharmacological part of the science. I always say that it is better not to use any earbuds for cleaning of the ear. If sometimes something goes in the ear like water or a foreign body, water, you don't have to do anything else except jumping at the same point and it will come out. About the rest thing like foreign body or an insect or you have to consult a ENT surgeon. See what is there. When we talk about ear, it's basically we balance our body with the help of the ear. And we say and that if you are able to see while walking, it is just because of the ear. Ear has got basically two parts. One, which is more important, is deafness, and other part is balance. Deafness can be just because of the external ear, middle ear and inner ear. And depending upon the age, it is commonly that if something there like wax or a normal secretion which gets accumulated in the external auditory canal, ear canal, God gives you deafness, pain, infection. So what we have to do, we have to be on the safer side, use only prescribed drugs by a qualified consultant ENT surgeon. Second, the most common thing and very commonly occurring is ear discharge. Depending upon the quality and the quantity of the ear discharge, we can say that it is a safe or it is unsafe. Because if it is discharge is coming, most commonly it is from the middle ear. Middle ear discharge always indicate that there is something in the perforation or TM membrane rupture. So if the discharge is copious, mucoid or it is slimy, we say it is the safe otitis media and can be treated by a conservative management. Second, if the discharge is less and painful, we say it is the unsafe otitis media and you have to consult a ENT surgeon. In both the cases, the second case always requires surgery, which is already being done in the Nishat Hospital for the last 25 years. And the second part and the first part, which give you the mucopurulent discharge, it's basically safe otitis media because the rupture of the tympanic membrane, but this rupture never heals. So that should be treated by surgical part. And we call it as an operation under local anesthesia, that is staying in the hospital for a day, that's all. Regarding the inner ear, there are so many things, but one of the most common is sensory neural hearing loss. And in sensory neural hearing loss, that means the inner ear is involved. The inner ear is important also for the management of your balance disorders. So the inner ear disorders may present with tinnitus, which is a very, very common problem in the older age group. And this tinnitus is basically, let's say, extra sound when there is no sound externally, that means in the environment, and then you perceive a sound, we call it as a tinnitus. In tinnitus, basically the ear anatomical part is very good, but the functional part is deranged, and that requires a long-term treatment and advice from the consultant specifying the patient that there's nothing life-threatening. Second part is balance, which is an urgency, and where we have to treat robustly to diagnose and to know the cause why the patient is suffering from the dizziness or the vertigo. This is all a basic idea about your ear problems. Thank you.